I just want to say I am so happy to see as many of you that could be here. And I think there's some people that are listening in remotely. Is that right, Dom? People are like tuning in on Blue Jeans. So that is fantastic. That is fantastic. Um, and I also want to say thank you to the people who dressed up because it really makes it into a festive and momentous and serious occasion that we took this seriously. So, congratulations and welcome. Um, this is a momentous occasion for the graduating chiefs, for you, for your families, and you should be really proud that you've achieved what you've achieved during these past 4 years. You've really worked hard and you've shown amazing dedication to this place and the work that we do here. And you've each contributed to our department and to the institution and in many, many, many ways. You've survived the unparalleled insecurities of internship. You've survived the busiest labor floor in Philadelphia. You've conquered the PETU as a third year, and as chiefs, you've shown like a maturity in your skills that I think many of us were doubting with what's going to happen. No, we were all sure of that, and your willingness and your ability to mentor and care for your juniors and the learners on your services was really quite apparent to us. And I think the proof of your success for me was on Friday mornings when I would torture you with the weekly gratitude that I made you give me. And people would go around saying, I'm grateful that I'm going to see my nephew who was born last week, or I'm grateful that I get to see my mother this weekend, or I'm grateful I'm not working this weekend. But always there was a junior resident who would say, I am grateful for my chief and for my team who was here with me on OB days or on OB nights. And I just think that speaks wonders to this program, that you get through this 4 years, both learning how to care for patients, but to care for each other and to mentor those below you. So I'm really proud of all 7 of you. Cynthia, I know you came in on this fairly late, but you have like done that with just such poise and aplomb. And I really applaud you especially for everything that you've gone through too. Congratulations, everyone. And I'm not allowed to sing because I'm a super spreader.
Please, no singing. We could have set that up too. We could have gotten extra equipment for that. So thank you all for coming and for having this be as festive an occasion as we could possibly make it be. It is a little odd to have graduation this way in Zubrau. For me personally, it's a little bit odd to be awake in Zubrau, which doesn't happen very often. But really, I want to say thank you to the chief class, because this has been an exceptional group. It was a special group from the beginning. As you know, this was sort of a surprise that we would have a class with 4 men in it. And I remember Roz Levitt at HUP being really horrified that we got all the good male applicants in Philadelphia. But not just because of the men, but also because of the whole rest of the class. It's been a wonderful residency group. And really, especially to thank you guys for the way that you have finished the program. There hasn't been a group that has finished with this degree of cohesiveness and good feeling in quite a while. And it's remarkable and lovely to have you guys sort of with your heads in the game all the way really up until the end has really been remarkable. So for that, I am definitely grateful. Thank you. I think what's exciting about finishing your residency is all the stuff that you haven't quite realized yet that you're going to discover when you move on. And you remember the first day of your second year when the new interns show up on the floor and all of a sudden you realize that you actually did learn something in your internship. And it's shocking because for the last 12 months, you've been the stupidest person in the room, and then all of a sudden new people come and it's an epiphany that happens, right? You can see the interns cheering for tomorrow, which is wonderful. And so I think it's nice as an attending that you get to realize things about yourself that you didn't know also. And one of the things that I hear over and over again from Penn State grads after they leave is how well prepared they feel and how they remark back, like, I had this horrendous case and I actually like was okay with it. And I was so worried that I wasn't going to be prepared, because it's scary all of a sudden to be the person in charge of taking care of sick patients. But you really are prepared. You really are ready to do it. And those things that you may not be 100% familiar with, you are totally prepared to learn them. And so there's nothing frightening about it. It's actually a wonderful, expansive experience that's awaiting you in the first few months on your new positions. So I'm a little jealous of that, and I hope that you all really enjoy it. And so after that, I just want to sort of move into the program, and we can get things moving along. So we're going to do things in a little different order this year. I think we're going to present awards first. Actually, I'm not sure, Bethany, did you have some remarks you wanted to make also? Yes, I'm sorry, I totally forgot.
But I was going to take my time when I came up later, but I just wanted to say to you guys, huh? Oh, I'm Bethany Goins. I'm the Associate Program Director. I came in to this residency program in their second year. I was sequestered in New Jersey, so I didn't interact with a lot of them until their third year and fourth year, and it's been a real pleasure to get to know all of them and see them grow in their skill set. And I really want to emphasize just how tremendously proud I think we all are of you of just handling two big upheavals in the program, closing of Hahnemann and then a pandemic, and just navigating all the changes constantly. And you've continued to show up to work and be an example to your under years of professionalism and duty to your patients. And I think that is to be applauded in such unique circumstances. So I really wanted to emphasize that. I think you guys deserve an extra round of applause for coming out on top from this end. And that's all I was going to say.
So, Stephanie, you were going to give an award. Wait, no, hang on a second. I'm getting it wrong. You're going to win an award. Surprise.
I think these are the resident awards, correct? Right, so this is up to you guys to go. I wonder who wins.
Okay, hello everyone. I'm Matt Janssen. I'm one of the graduating chief residents. I'm just going to present a few awards to some of the attendings that have really made this a special place and done so much to help us grow and learn over the time that we've been here. So the first award is the 35th Annual Clarence C. Briscoe Award to the Physician with Excellence in Teaching and Practice of OBGYN. Notably, these are all awards that are voted on by the different classes and everything. And so we would like to give this award unsurprisingly, to Dr. Stephanie Ewing.
Oh, thank you. All right, I want to say like two things to you all. You know that I can't leave a room without saying something. So this is the 25th anniversary of my graduation. So for me, this is a really significant moment. I was up the street around the corner where some of you live in the Penn, was where my graduation was. I've hoped to be able to give you guys, bits of wisdom. And the last 3 months have been about finding your voice and listening to your voice. And I know Cynthia knows that I said that to her about 15 times. I want to know what you think. What do you want to do? Now's your chance. And I really want to make sure that you use your voice for good. And I want to make sure that you use your voice as an advocate for women and their families, as well as for people of color, as well as, underserved communities. So please take your voices, use them loud and clear, and congratulations.
Okay, our next award is the CREOG Faculty Award, and this goes out to the faculty that we've chosen who has really shown excellence in resident education over the past year for us, and this one goes to Dr. Jordan Treebwasser.
Oh, I see, okay. The framer was out of business.
I do not like to speak usually, but I just wanted to congratulate all of you and thank you for taking such wonderful care of your patients. And I'm sorry that I missed your last 5 weeks, but it's good to see you all again.
Okay, so our next award is for, that's all, again, voted on by all of us, is the Award for Excellence in Teaching for the faculty member that demonstrates excellence in teaching both residents as well as in medical students throughout the past year. And this goes out to Dr. Heidi Harvey. And then another award is the that we're really excited about is the Outside Service Award, which is given to the physician in recognition of their service to all of the resident patients and our clinic patients and their care both in the clinic as well as in labor and delivery. And this goes to Dr. Nikki Salva.
There's 2 other awards that I have to do video links, and let's see how these work. The John Riva MD Oncology Award for Excellence and Achievement in Gynecologic Oncology, voted on by the GYN Onc faculty, is unsurprisingly given to Diego Aviles. The SMFM Resident Award for Excellence in Obstetrics is, again, unsurprisingly, to Dr. Janssen. They're all out of order, but that's okay. Yeah, that's this one. One too, so it's okay. Don't go anywhere. Another thing for Matt is an annual award that's given every year just to thank the administrative chief resident for all of the extra work that they do. This year we experimented with having a single chief, and I think it only worked because it was Matt Janssen. Honestly, like I really do. And next year we're going to go back to having 2 administrative chiefs, not because we don't have anybody as wonderful as Matt, but just because it's just too much. It's too much, but really he bore up really well and was effective and kind throughout the entire process, and really never even got crabby once, which is wonderful. And I'm like so grateful that I had somebody so wonderful to work with, especially during a year when we were like constantly manipulating schedules and changing this. And I mean, you had to go from 6 residents to 7, and then we had to go changing all the blocks. It was just an administrative nightmare, and he really handled it so wonderfully. So thank you so much for that. Lastly, got it, is the Zachary Award, which is given annually to the resident who has demonstrated the best overall performance in the entire program. Not necessarily best surgeon or best obstetrician, but just the resident who we feel, and the attendings have voted on this, has really shown us their best for the longest period of time during the program. And again, for all the same reasons that I mentioned just before, and also because of wonderful patient care, a compassionate approach to the women that he's taking care of, and outstanding skills, the Zachary Award this year goes to Dr. Janssen. And with that, we will move on to presenting individual diplomas.
Thanks. So this is a real pleasure for me to speak about Matt. And again, this group went through a lot of interesting things over the course of 4 years. So when they interviewed, they knew that their chairman was stepping down. So they had to deal with, let's say, a colorful interim chair to start the year. They then dealt with inpatient epics starting like within 4 months of being here. And that was quite the show. And then, of course, everything that's been talked about already that they've gone through, and all of them, and Matt especially in this group, just a pillar of strength. And, you know, other attendings would always comment that our residents were extremely solid, and everybody loved working with them. For Matt, you know, he clicks all the boxes in terms of academics, intellect, his clinical judgment, his skills. When you look at his evaluations, one of his evaluations at the end of the second year said, yeah, we really can't find anything to criticize. And so from that standpoint, it's been an absolute pleasure to work with Matt. And I think the things that always impressed me were just his mannerisms in terms of how he handles the day and how he handles the residents, his patients, the team. I could never tell if Matt was post-call, coming on to call, just had a great manner about him. And Dom and I usually will talk 2 or 3 times a week, especially if we've had a bad day. And, you know, Dom, there are certain days when there's only one of us to cover everything in the hospital. So I called Dom on one of those days when he's in the hospital. And I said, did you go around yet? And he's like, yeah, you know, Matt's over there. We're good. He'll handle it. And another comment that Dom made was, I've never seen Matt get upset. And sometimes I would kind of play with him and needle him to see if I could get him going, and not once. You know, he took it in stride. You know, my only complaint about Matt was that when I was covering high-risk clinic, he didn't have any snacks when he was the chief. So that's like, that he failed. But in every other way, he was great. Also, you know, I feel like I let him down sometimes in the first 2 years when he wanted to get projects done. He'd come with me, great ideas, and I'd say, I'd look at it, we'd try to get it going. And so for Matt, thank God Jordy came. And Matt, your perseverance in terms of getting things started, and you really did a great job on that QI project. You wrote in your personal statement when you applied for residency, you said that your goals for the 48 months of residency were to develop into a culturally, emotionally, and intellectually competent physician. Now, I can't speak for the cultural part, but I think you knocked it out of the park in the other ways. And, it has been a real pleasure to work with you for these 4 years, and I am really excited that we're going to get to continue to work with you for 3 years, doing your fellowship with us, which you only work with a handful of us here, and you get to deal with every day a different plan. And it was always interesting the way you would deal with, let's say, the differences of opinion that we would all have. And so you get to now experience even 10 more people who will have 10 different opinions. I think you're going to continue to excel. You're going to knock it out of the park, too, with fellowship. And I really look forward to hearing from you and being able to work with you again for the next 3 years. So it has been a pleasure, Matt.
Thank you.
Sure.
So it's of course an odd year. We were unable to sort of have a traditional party the way that we normally do. We tried in lieu of that to do some nice things. And so we have nice professional frames for your certificates that are going to be mailed to you, so you don't have to carry them on airplanes. And in the back, you'll find a bottle of champagne and a cake to take home and celebrate with your families. And I'm just so grateful for the way that this group has conducted themselves through what has been a difficult year. And I'm so optimistic for all of you in how you will be enjoying the next year of your careers. So thank you very much and good night.
There was supposed to be a slideshow of some resident pictures and videos, but Matt's computer crashed. He's texting me that he's been trying to frantically upload it and he has not been able to, but potentially that could be emailed out to you guys, so sorry. All right. Congratulations.
I know. I tried. Oh, I tried. It was so good.